few analysts saw it coming.
This may be the most interesting election in the history of the country.
Donald Trump pulled off a surprise win, and now experts are looking at what that might mean for the country.
I don't think there's any question that Obamacare will either be repealed or dramatically changed.
Some physicians, like Dr. Kenneth Beer, are excited about that prospect.
As a physician, Obamacare has been overly intrusive, and some of the regulations that they impose have really not helped patient care at all.
While doctors like Beer are embracing change, many of the 22 million Americans who got health insurance because of the Affordable Care Act fear they might lose it.
From anecdotally what I've heard this morning, I think people are worried about it.
Louisa McQueenie works with Covering Florida. She's helped hundreds of Floridians get health care for the first time under Obamacare.
You can see it in people's eyes. It's financial protection, it's sleeping at night.
Repealing it altogether won't be so simple. Several aspects of Obamacare are hugely popular, namely the fact that 26-year-olds can still be on their parents' health insurance plan and that people with pre-existing medical conditions are able to get insurance.
It's going to be very difficult for Republicans to take those things away and not cost them at the polls in future elections.
So how do Republicans save those benefits, scrap the rest, and pay for it?
And the Republicans have not been very clear on what that would be.
Regardless, Obamacare is on President-elect Trump's chopping block.
Wanda Moore reporting, and indeed echoing that last point. Ever since the Affordable Care Act, Obamacare became law, Republicans have vowed to repeal and replace it. And they've always been criticized for, what do you replace it with? Repealing it may be the relatively easy part, politically contentious though, but replacing it, that too will be a mammoth battle in Congress, no matter the new majorities that then President Trump will have after January. Also, the